Hello, and welcome. Before we begin, I need to share something important with you. Everything we discuss today is general information only. It is not personal medical advice, and it is not personal financial advice. Every situation is unique, so please always speak with your own healthcare provider and financial advisor about your specific circumstances. Now, let's talk about something that matters deeply to all of us: your health, your dignity, your rights when you walk through those hospital doors. I know why you're here today. You've heard the stories, haven't you? A friend who waited hours in emergency, a neighbor who felt ignored by doctors. Perhaps you've had your own experience where you felt small, confused, or powerless in a hospital corridor. Maybe you're worried about what happens if you need surgery. Maybe you're concerned about the bills. Maybe you're caring for a spouse and you don't know what questions to ask or what rights they have. And here's the thing: you're not alone in feeling this way. Many Australians over 50 tell me the same thing. They feel anxious about hospitals. They feel the system has changed. They feel unsure about what they're entitled to, what they can ask for, and what they should expect. That anxiety, it's completely valid, because hospitals can be intimidating places. The language is confusing, the processes are complex, and when you're unwell or worried about someone you love, it's hard to think clearly. So today, I want to give you something valuable. I want to give you knowledge. I want to give you clarity, and I want to give you confidence. By the end of our time together, you'll understand your rights as a patient in the Australian healthcare system. You'll know what questions to ask. You'll know what standards to expect. And you'll feel more empowered the next time you or someone you care about needs hospital care. Because here's what I believe: you deserve to feel safe. You deserve to feel heard. And you deserve to be treated with dignity and respect every single time you interact with our healthcare system. Let's begin. Now, to understand where we are today, we need to look back. We need to understand how things used to be and how they've changed. If you're in your 50s, 60s, or 70s, you'll remember a different Australia. You'll remember a time when hospitals felt smaller, more personal, when your local GP knew your family, when a hospital stay meant a week of rest, not being discharged the same day. Let's go back to the 1970s and 80s. Back then, Medicare didn't exist yet. Medibank came first in 1975. Then it was abolished. Then Medicare was introduced in 1984, and it changed everything. Before Medicare, many Australians relied on private health insurance or paid out of pocket. Hospital care was expensive. Not everyone could access it easily. There were real barriers. Medicare changed that. It created a universal system. It said that every Australian, regardless of income, has the right to be treated in a public hospital without charge. It said that your health should not depend on your wealth. That was revolutionary. But here's what's happened since. Our population has aged. Medical technology has advanced. Treatments that were impossible 40 years ago are now routine, and costs have increased dramatically. At the same time, hospitals have become busier, much busier. Emergency departments see more patients than ever before. Elective surgery waiting lists have grown. Staff are under pressure. Resources are stretched. And here's the economic reality. State governments fund public hospitals, but their budgets are tight. Every year there's tension between demand and supply, between what people need and what the system can provide. This creates challenges. You might wait longer for non-urgent surgery than you did 20 years ago. You might feel rushed during consultations. You might be discharged sooner than you expect. Does this mean the system is broken? No. Does it mean you have fewer rights? Absolutely not. But it does mean you need to be informed. You need to understand what you're entitled to. You need to know how to advocate for yourself or for someone you love. Because the system is complex, and complexity can feel overwhelming. But here's the good news. Your rights in Australian hospitals are strong. They're protected by law, by professional standards, and by ethical codes. And when you understand them, you can navigate the system with confidence. So let's talk about what those rights actually are. First, let's talk about consent. This is fundamental. This is the bedrock of your rights as a patient. In Australia, no one can treat you without your consent. Not a doctor, not a nurse, not a specialist, no one. This is called informed consent, and it means several things. It means you have the right to understand what's being proposed, what treatment or procedure, what the benefits are, what the risks are, what the alternatives might be. It means you have the right to ask questions, as many questions as you need, until you feel you truly understand. And it means you have the right to say no. You can refuse treatment. You can refuse a test. You can refuse a procedure, even if your doctor thinks it's a good idea, even if your family thinks you should do it. Your body, your choice. Now, there are some exceptions. If you're unconscious and it's an emergency, doctors can treat you to save your life. If you lack mental capacity to make decisions, there are processes in place to protect you. But in general, competent adults have absolute authority over their own medical care. This is powerful. But here's where it gets tricky in real life. Sometimes consent forms are handed to you quickly. Sometimes medical language is used that you don't understand. Sometimes you feel pressure to just sign and agree. Don't. If you don't understand something, say so. If you need time to think, ask for it. If you want a second opinion, you're entitled to one. Your consent should be truly informed, not just a signature on a form. Let's talk about privacy next. Your medical information is private. It's protected by law, specifically by the Privacy Act and by state and territory health records legislation. What does this mean practically? It means your medical records can't be shared without your permission, except in very specific circumstances. It means staff shouldn't discuss your case in public areas where others can overhear. It means you have the right to know who has access to your information. If you're worried about privacy, you can ask who will see your records. You can ask that certain information be kept more restricted. You can request that your records not be shared with particular individuals. And here's something important. You have the right to access your own medical records. If you want to see what's been written about you, you can request your records. There might be a small fee, there might be a short delay, but you're entitled to see them. Why might you want to do this? Perhaps you're getting a second opinion and want to share complete information. Perhaps you're changing doctors. Perhaps you simply want to understand what's been documented. Your records, your right to see them. Now let's talk about communication. You have the right to clear communication. You have the right to information in a language you understand. You have the right to have interpreters provided if you need them. This isn't a favor, this is a right. If English isn't your first language, or if you're deaf or hard of hearing, hospitals must provide appropriate communication support. They must ensure you can understand what's happening and participate in decisions about your care. And even if English is your first language, medical terminology can be confusing. You have the right to have things explained in plain language. You can ask for diagrams. You can ask for information to be written down. You can ask doctors to repeat themselves. Good doctors welcome these questions because they know that informed patients have better outcomes. Let's talk about dignity and respect. This might sound soft, but it's crucial. You have the right to be treated with dignity. You have the right to have your cultural and religious beliefs respected. You have the right to your personal preferences considered. What does this look like? It means you shouldn't be left exposed unnecessarily during examinations. It means your modesty should be protected. It means if you need a support person with you, that should be accommodated wherever possible. It means your name should be pronounced correctly, your beliefs should be acknowledged, your fears should be taken seriously. You are not just a condition. You are not just a bed number. You are a whole person with a life story, and the healthcare system should treat you that way. Now, let's talk about safety. You have the right to safe, quality care. This is protected by the Australian Charter of Healthcare Rights, which applies in every state and territory. What does safe care mean? It means hospitals must have systems to prevent errors. It means they must follow proper infection control. It means they must monitor patients appropriately. It means they must identify and respond to deterioration quickly. If you have concerns about safety, you should raise them. If you think something isn't right, speak up. If you believe a mistake has been made, ask questions. This isn't being difficult. This is being responsible. Because errors can happen, systems can fail, and patients and families are often the first to notice when something seems wrong. Your voice matters. Let's talk about choice. Within the public system, your choices might be more limited than in the private system. You generally can't choose your surgeon for public elective surgery. You'll be allocated based on availability and priority. But you do have choices. You can choose whether to be treated as a public or private patient in a public hospital if you have private health insurance. You can choose whether to accept or decline participation in research or teaching. You can choose what happens to your tissue samples after surgery. These choices are yours to make. And if you have private health insurance, you have additional choices. You might choose to use that insurance to access faster treatment. You might choose a private hospital. You might choose a specific specialist. But here's something crucial. You need to understand the financial implications of these choices, because private treatment means gap fees. It means out-of-pocket costs. It means complexity. We'll come back to this. Now, let's talk about complaints. You have the right to complain if you're unhappy with your care. You have the right to have your complaints taken seriously, and you have the right to an explanation and an apology if things went wrong. Every hospital has a patient liaison officer or complaints manager. Every state and territory has a health complaints commissioner or ombudsman. If you're not happy, you can raise your concerns with the ward staff first. If that doesn't resolve things, you can ask for the nurse unit manager, then the patient liaison officer, then the hospital executive, then the external complaints body. There are multiple levels, multiple opportunities to have your voice heard. And if there's been serious harm, you might have legal rights as well. You might be able to pursue compensation. You might be able to make a formal notification to the Australian Health Practitioner Regulation Agency if you believe a health professional has behaved inappropriately. These are your protections, your safety nets. Let's pause here for a moment. I've just given you a lot of information about consent, privacy, communication, dignity, safety, choice, and complaints. These are your core rights. But knowing your rights is one thing. Actually exercising them in a busy, stressful hospital environment is another. So let's talk about how this works in practice. Let me tell you about Bruce and Jenny. They're not real people, but their story represents the experiences of many Australians I've worked with over the years. Bruce is 68. He's retired. He was a builder. He's generally healthy, but he's been having chest pain. His GP referred him to a cardiologist who recommended an angiogram and possible stent placement. Jenny is 65. She's Bruce's wife. She worked in administration before retiring. She's organized, careful, and worried about the costs. They have private health insurance. They've had it for years. They upgraded to a higher level of cover when they turned 50, thinking it would protect them. But now, faced with actual treatment, they're confused. Should Bruce go through the public system? Should he use his private insurance? What are the wait times? What are the costs? What are his rights in each system? Let's walk through their journey. First, they consider the public option. Bruce's cardiologist works in a public hospital. He can be placed on the public waiting list for the procedure. It's classified as Category 2, which means it should happen within 90 days. In the public system, Bruce won't pay for the procedure itself. He won't pay for the hospital bed. He won't pay for the surgeon or anesthesist. But he might wait, possibly weeks, possibly a few months, depending on how busy the hospital is and how urgent his case is compared to others. And he won't get to choose his surgeon. He'll be allocated to whoever is available and rostered on. Bruce is nervous about this. He wants to know who will be operating on him. He wants it done sooner. The chest pain is scary. So they consider the private option. Bruce can use his insurance to have the procedure done quickly, possibly within a week or two. He can choose his cardiologist to perform it. He can have a private room. But here's the catch. Even with insurance, there will be gap fees. The cardiologist charges more than what the insurer pays. The anesthesiast charges more. There might be fees for specific devices or implants. These gaps can add up to thousands of dollars. Jenny is worried. They're on the age pension now with some savings. They don't want to drain their savings unnecessarily, but they also don't want Bruce to suffer or wait if it's dangerous. What should they do? Here's what I told them. Ask questions, lots of questions. First, ask the cardiologist about urgency. How urgent is this really? Is waiting 90 days safe for Bruce's specific situation, or does he need it sooner? This is crucial because sometimes Category 2 doesn't accurately reflect individual risk. Sometimes a patient needs escalation. If Bruce's condition is worsening, his cardiologist can request prioritization. Second, ask about costs up front. If going private, what exactly will the gap fees be? Get it in writing. Many specialists now provide written quotes. Don't be embarrassed to ask about money. This is a significant expense. You have every right to know what you'll pay before you commit. Third, understand what the private insurance will actually cover. Call the insurer. Ask specific questions about this procedure in this hospital with this doctor. Don't rely on general policy information. Bruce and Jenny did this, and here's what they discovered. The cardiologist told them that while Bruce's condition needed treatment, it wasn't immediately life-threatening. Waiting 60 to 90 days was medically acceptable. But the cardiologist also said that if Bruce had the procedure done privately, he could schedule it quickly and be there personally, which might give Bruce more peace of mind. The gap fees would be around $3,000 all up. Jenny and Bruce thought about it. They talked it through. They decided that $3,000 was manageable from their savings and that Bruce's peace of mind was worth it. So they went private. The procedure went smoothly. Bruce recovered well. They paid the gap fees, which were exactly what they'd been quoted. But here's the important part. They made an informed choice. They understood their rights and options in both systems. They asked questions. They got clear information. And they decided based on their own values and circumstances. That's empowerment. Now, let me tell you what happened to Jenny a year later. Jenny started having hip pain, severe hip pain. Her GP referred her to an orthopedic surgeon who confirmed she needed a hip replacement. This time, they made a different choice. Jenny wasn't in immediate danger. The pain was manageable with medication and physio for a while. And after paying for Bruce's procedure, their savings were lower. So Jenny went on the public waiting list, Category 2, target of 90 days. She waited 4 months. It was frustrating. The pain got worse. She had to use a walking stick. She felt limited in what she could do. But when the surgery date came, everything went well. The surgeon was excellent. The nurses were kind. The hospital was clean and professional. She recovered in a shared room, which was fine. She made friends with her roommate, actually. and it cost them nothing out of pocket. Different circumstances, different choice. Both valid. But here's what's crucial. In both cases, Bruce and Jenny knew their rights. When Bruce was in hospital for his angiogram, he asked questions about the procedure beforehand. He made sure he understood the risks and benefits. He gave informed consent. When Jenny was in for her hip replacement, she spoke up when her pain wasn't being managed well enough post-surgery. She advocated for better pain relief, and she got it. They both read the information provided about infection prevention and early mobilization. They both participated in their care. They treated the staff with respect, and the staff treated them with respect in return. This is how the system should work. But it doesn't always. So let's talk about what happens when things go wrong. Imagine you're in hospital and you feel something isn't right. Maybe you've been waiting hours in emergency and no one has explained what's happening. Maybe your call button isn't being answered. Maybe you overheard staff talking about you in a way that felt disrespectful. Maybe you think a medication error has occurred. What do? First, speak up calmly and clearly. If you're waiting too long, ask the triage nurse for an update. Ask where you are on the priority list. Ask what the expected wait time is. If your call button isn't being answered, press it again. And if still nothing, call out or ask a family member to find a nurse. If you have a concern about treatment or medication, raise it immediately with the nurse or doctor looking after you. Say clearly, "I'm concerned about this. Can we please discuss it?" Most issues can be resolved at this level. Most staff want to help. They're just busy, and sometimes things slip through. But if you're not satisfied, escalate. Ask to speak with the nurse in charge of the ward. Ask to speak with the patient liaison officer. Most hospitals have these roles, and their job is specifically to address patient concerns. If you're too unwell to advocate for yourself, this is where family or friends become crucial. They can speak up on your behalf. They can ask the questions you can't ask. And here's something important. You have the right to have a support person with you in most situations. If you want your daughter, your son, your partner, or a friend present during discussions with doctors, you can request that. There are some exceptions. During certain procedures, it might not be possible. In intensive care or emergency departments, there might be restrictions for infection control or space reasons. But in general, you don't have to face the hospital system alone. Now, let's talk about financial rights and protections. If you're a public patient in a public hospital, you should not receive a bill for your treatment. Not for the surgery, not for the hospital stay, not for the doctors. If you do receive a bill and you believe you shouldn't have, query it immediately. Contact the hospital billing department. It might be an error. Sometimes you might receive bills for things not covered by Medicare, perhaps medications to take home, perhaps some medical equipment. These are usually small amounts, but you should understand what you're being charged for. If you can't afford to pay, talk to the hospital social worker. There are sometimes hardship provisions. There might be payment plans available. Don't just ignore bills. Address them. If you're a private patient, you will receive bills from the hospital, from the surgeon, from the anesthetist, possibly from other specialists like pathologists or radiologists. These bills should match the quotes you were given beforehand. If they don't, question them. You have the right to an itemized account. You have the right to understand what each charge is for. And you have the right to dispute charges you believe are incorrect. If there's a significant dispute, you can contact your private health insurer. You can contact the private health insurance ombudsman. There are protections and processes. Let's talk about discharge. This is an area where many people feel rushed or confused. You have the right to be involved in discharge planning. You have the right to understand what will happen after you leave hospital. what medications you'll need, what follow-up appointments are necessary, what warning signs to watch for. If you don't feel ready to go home, say so. If you have concerns about managing at home, raise them. The hospital has an obligation to ensure discharge is safe. They should consider your home situation. Do you live alone? Do you have support? Can you manage stairs? Do you have transport to get home? If you need extra support, the hospital social worker can help arrange services, perhaps home nursing, perhaps meal delivery, perhaps equipment like a shower chair or walking frame. Don't be discharged until you feel confident you can manage or until appropriate support is in place. And if you're being discharged and you genuinely believe it's unsafe, you can refuse. You can ask for a second medical opinion. You can escalate your concerns. Your safety matters more than bed pressure. Now, let's talk about end-of-life rights. This is sensitive, but it's important. If you're seriously ill, you have the right to make decisions about your care, including decisions to refuse life-prolonging treatment. You can create an advance care directive. This is a legal document where you specify what medical treatments you would or wouldn't want if you become unable to communicate. For example, you might specify that you don't want to be resuscitated if your heart stops. You might specify that you don't want to be on a ventilator indefinitely. You might specify that you want palliative care focused on comfort rather than aggressive treatment. These directives must be respected. You can also appoint a medical power of attorney. This is someone you trust to make medical decisions on your behalf if you can't make them yourself. These are powerful documents. They give you control even when you're not conscious or capable. Every Australian over 50 should consider creating these documents because none of us knows what the future holds. Talk to your GP about it. Talk to your family about it. Make your wishes known. Let me give you a real principle here. The healthcare system should serve you. You should not have to serve the system. You are not a burden for asking questions. You are not difficult for advocating for yourself. You are not selfish for wanting dignity and respect. You are a human being with rights, and those rights are there to protect you. So, what should you actually do? What are the practical steps you can take today to protect yourself and understand your rights better? Let me give you a clear action plan. Step 1. Get informed about your specific health situation. If you have a chronic condition, learn about it. Read from reputable sources. Health Direct Australia is excellent. The Better Health Channel is excellent. Your condition-specific organizations like the Heart Foundation or Arthritis Australia provide good information. Understanding your condition means you can have better conversations with your doctors. You can ask better questions. You can recognize when something doesn't seem right. Step 2. Organize your medical information. Keep a file, physical or digital, with your important medical records, test results, medication lists, specialist reports, immunization records. When you go to hospital, bring this information. It helps staff understand your history quickly. It prevents errors. If you take multiple medications, keep an up-to-date list. Include the name, dose, and frequency of each medication. Include any allergies or bad reactions you've had. This simple step can prevent medication errors. Step 3. Know your insurance situation. If you have private health insurance, understand your policy. What level of cover do you have? What's included? What's excluded? What are the waiting periods? Call your insurer and ask questions. Get clear answers. Don't assume. If you're thinking of dropping your insurance to save money, understand the consequences. You might face waiting periods if you want to rejoin later. You might pay more due to age-related loading. Make informed decisions. If you don't have private insurance and you're relying on Medicare and the public system, that's completely fine. The public system provides good care. Just understand what's covered and what's not. Step 4. Create your advance care directive. Seriously, do this. Don't put it off. The forms are available online for each state and territory. They're not complicated. You can fill them out yourself, though you might want to discuss them with your GP. Once completed, give copies to your GP, to your nominated medical power of attorney, and to family members who should know your wishes. Update it if your circumstances or wishes change. This document gives you control. It gives your family clarity. It prevents agonizing decisions being made in crisis moments. Step 5. Build a relationship with your GP. Your GP is your advocate in the health system. They coordinate your care. They know your history. They can help you navigate specialist referrals and hospital admissions. See the same GP consistently if possible. Build that relationship. Don't just go to whoever is available at the bulk billing clinic. A good GP is worth their weight in gold. Step 6. Prepare before hospital admissions. If you're having planned surgery or a procedure, prepare thoroughly. Write down your questions beforehand. Bring the list to your pre-admission appointment. Don't rely on remembering everything. Ask about the procedure itself. Ask about anesthesia. Ask about recovery. Ask about risks. Ask about alternatives. Ask about costs if going private. Get quotes in writing. Ask what you should bring to hospital. Ask what medications to continue or stop. Ask about fasting requirements. The more prepared you are, the more confident you'll feel. Step 7. Bring a support person when possible. For important appointments or admissions, bring someone with you, a partner, adult child, or trusted friend. They can take notes. They can remember information you might forget. They can ask questions you might not think of. They can advocate for you if you're feeling overwhelmed or unwell. 2 heads are better than 1. Step 8. Practice assertive communication. You don't have to be aggressive, but you do need to be clear. If you don't understand something, say, "I don't understand. Please explain that differently." If you're in pain, say, "My pain is not well controlled. I need better relief." If you're concerned, say, "I'm worried about this. Can we discuss it?" Use I statements. Be respectful but firm. Don't apologize for having needs or concerns. Your voice matters. Step 9. Know where to get help. Save these contacts in your phone or write them down somewhere accessible. Health Direct Australia. You can call them on 1-800-022-222 for health advice from a registered nurse 24 hours a day. Each state and territory has a health complaints commission. Find yours and save the contact details. If you're on the age pension or receive Centrelink payments, you might be eligible for assistance programs you don't know about. My Aged Care can assess you for home support services. Call them on 1-800-200-4222. Financial counseling services are free and can help if medical costs are causing you stress. The National Debt Helpline is 1-800-007-007. You don't have to navigate this alone. Help is available. Step 10. Review your situation annually. Once a year, perhaps on your birthday or at New Year, review your health and financial situation. Are your medications still appropriate? Has anything changed? Do you need to see any specialists for checkups? Is your advanced care directive still current? Is your private health insurance still meeting your needs? This annual review keeps you on top of things. It prevents small issues becoming big problems. These 10 steps are manageable. You don't have to do them all at once. Pick one, start there, then do another. Each step you take increases your confidence and your control. Because here's the truth. The Australian hospital system, both public and private, provides good care overall. We're fortunate to live in a country with universal health care. We're fortunate to have skilled doctors and nurses. But the system is complex, and it's busy, and sometimes things fall through the cracks. Your job is to be informed, to be organized, to speak up, to advocate, not to be adversarial, not to be difficult, but to be engaged. Because engaged patients get better care. Engaged patients have better outcomes. Engaged patients feel more in control. And control reduces anxiety. We're near the end of our time together. Let me leave you with some final thoughts. You've worked hard your whole life. You've raised families, built careers, contributed to your communities. You've paid taxes that fund Medicare and public hospitals. You have earned the right to good health care. You have earned the right to be treated with dignity. Don't ever feel like you're a burden on the system. Don't ever feel like you should just be grateful and not ask questions. You are entitled to ask questions. You are entitled to understand. You are entitled to participate in decisions about your own body and your own health. And here's something I want you to really hear. Getting older doesn't mean you lose your rights. It doesn't mean you lose your voice. It doesn't mean you become less important. Every person, regardless of age, deserves excellent health care, deserves respect, deserves compassion. If you encounter ageism in the healthcare system, call it out. If you feel dismissed because of your age, push back, politely but firmly. Your health concerns are legitimate. Your pain is real. Your questions are important. Now, let's talk about the bigger picture for a moment. This is the third act of your life. The first act was childhood and education. The second act was career and raising families. Now you're in the third act, and this act can be wonderful. It can be fulfilling. It can be joyful. But it requires taking care of yourself, your health, your finances, your relationships, your sense of purpose. Understanding your rights in hospitals is part of taking care of yourself. It's part of being prepared, part of being empowered. But don't let health worries consume this stage of life. Yes, be informed. Yes, be prepared. But also live. Travel if you can. Spend time with people you love. Pursue hobbies and interests. Volunteer. Learn new things. Enjoy simple pleasures. Your worth is not measured by your health status. Your value is not diminished by needing medical care. You are living a full human life, and that life includes both joy and challenges, both independence and times when you need support. That's not failure, that's being human. So approach the healthcare system with confidence, not fear. With knowledge, not anxiety, with the understanding that you have rights and that those rights will be respected. And if they're not respected, you now know what to do. You know how to speak up. You know where to get help. You know the steps to take. You are not powerless. Let me remind you one final time. Everything we've discussed today is general information only. It is not personal medical advice. It is not personal financial advice. Your situation is unique. Please speak with your GP about your health concerns. Please speak with a financial advisor if you have questions about private health insurance costs or impacts on your savings. Please speak with a legal professional if you need help creating advanced care directives or powers of attorney. Get personalized advice for your specific circumstances, but use the information we've discussed today as a foundation, as a starting point, as a framework for understanding your rights and options. And remember, you're not alone. Millions of Australians are navigating this same system, asking the same questions, feeling the same concerns. We're all in this together. So be kind to yourself, be patient with yourself, and be your own advocate. You've got this. Thank you for spending this time with me today. I hope you feel more informed, more confident, and more empowered. Take care of yourself, and remember, you deserve excellent care. Until next time.